Welcome to Empowered. I'm Elizabeth Naumovski. As we get older, our risk of getting dementia is higher, and this is something that many worry about. Did you know that twice as many women get dementia as men do? Today, we're going to discuss the important topic of our aging brain and inflammation. And are we genetically predisposed to accelerated brain aging? Today, I'm joined by Jasmina Boban, Assistant Professor, Neuroradiology, Fellow, Vojvodina Institute of Oncology, Faculty of Medicine, University of Novi Sad, Serbia. Jasmina, welcome to Empowered.
Good evening. Actually, it's for you, it's good afternoon. And thank you very much.
I am so excited to speak to you. You and I met we've been talking about this for 10 months now. So what I want to do is begin this amazing conversation. How does the brain age in normal aging?
Well, as far as we know, it ages globally. So it means that the whole brain is getting smaller, our neurotransmitters are getting lower, and the whole function, especially the executive function, so the higher cognitive functions, are getting slower down by aging. And it's normal, it's physiological, and it's something that we will all go through with our aging.
So Jasmina, when does this start? You said, as we get older, is there a specific age that this begins?
It is a very interesting question. They say, as when I was at medical faculty, then they said that the aging of the brain starts after the age of 40. Today, we know that this is actually individual. So this initial point when your own brain starts aging is actually somewhere in between 25 and 50.
Wow, that's so much younger than what we've known or heard of, because when you talk about dementia or aging or an aging brain, you're usually thinking of somebody who's in their 70s or 80s.
That's true. That's an important point that you raised. Actually, your brain starts aging ages before it is actually evident. So your cognitive impairment, the cognitive slowing, starts after some time. So the brain starts aging, and then it's actually compensated in a way. And then after several years or several decades, it begins to show. So your cognitive functions begin to decline, and you're entering the stage where it's obvious by yourself and by your environment that actually your brain is aging and slowing, and that you're entering a phase of mild cognitive impairment.
So we were talking about inflammaging. What exactly is that?
It is a new term. Actually, it was introduced several years ago, and it is a combination of inflammation and aging. Now, what we know is that if we have systemic inflammation, for example, in obesity, or in some kind of chronic viral infection, or associated with malnutrition, with alcohol abuse. So these are all the things that make our body inflamed, but only at a low level. This actually reflects into your brain, and it makes it age a bit accelerated. So the whole cascade of brain aging starts earlier and goes much accelerated compared to normal physiological healthy, as we say, brain aging.
So how does the brain age in those various inflammatory processes, such as viral infections, post-COVID, or obesity?
What we know now is that our brain ages in similar way associated with inflammation. So the first, let's say, spots that are hit are actually our old brain. So the limbic system, the part of the brain that is associated with emotions, with memories, with a system of the appraisal, of the rewarding, and this is the part of the brain where aging actually starts. It is unfortunately connected with our thalami, with the part of the brain that is deep inside the brain, and that actually triggers our own voluntary and also involuntary actions. So
Okay.
This is the part that starts first.
This is fascinating. And I know so many people right now that are being affected by this, whether their parents are 70 or 80 or their spouse is 60. We're all being affected by it. So please don't go away. When we come back, we're going to delve a little bit more into what Jasmina has been researching. So please don't go away. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. On today's episode, we're discussing brain aging and inflammation. Jasmina, I wanted to talk to you about chemo brain because I've heard that term often. What exactly is it?
Chemo brain is also a relatively new term. It is associated with receiving of chemotherapy. So after or prior to surgery, usually patients that have cancers receive chemotherapy. This chemotherapy is associated with a lot of adverse effects. We know that most people lose their hair, they lose the power, sometimes they vomit, and they lose weight. And also their brain, unfortunately, enters a state of lower function. So this is a set of neurological and also psychological symptoms that are associated with receiving chemotherapy. Among these neurological symptoms, usually the patients report deficits in memory, in executive functions, in attention, concentration, which actually makes their everyday life a bit hard. Also, there is a set of psychological symptoms such as depression, anxiety that is associated both with the prognosis, with the cancer treatment, but also with the physical stress that their bodies are going through.
So if you've got chemo brain, is that long-term, or once you stop chemo, your brain functions go back to normal within time?
Usually your brain functions go back to normal or close to normal within time. They say that it's maybe twice or three times the length of the receiving chemotherapy. So twice or three times more you need to recover from chemotherapy. However, some patients report that their brain function never went back to normal, and it's also individually dependent.
So is there any imaging that can detect changes in your brain?
That is actually what I've been doing for 10 years. I do the magnetic resonance imaging of the brain with advanced methods. There are several advanced methods that can be used. One of them is volumetry. So we measure specific volumes inside the brain. I was talking about the limbic system that is affected by inflammation and brain aging in both settings. So we can measure small volumes of small structures inside our brains, compare it with healthy controls or with this person, but prior to chemotherapy, and see whether the volume is changing. It can go up, so it can raise, and also it can go down with receiving of the chemotherapy. The other technique is called MR spectroscopy. It is a technique where we measure the neurometabolite concentrations in small volumes. So with these measurements, we can say that the brain is entering the state of inflammation or neurodegeneration, and we can see more about this subtle differences inside our small volumes, so even smaller particles than with volumetry. And the third technique, which I'm also excited very much with, is tractography. It can reflect the white matter integrity and the function of our fiber tracts. So we can measure actually the neurotransmission indirectly in our brains. So these are the three techniques that I usually use. There is one more, it's called functional MRI, and it has something to do with neurovascular reactivity. So if we, for example, move our leg, then the neurovascular activity in our motor center will change. So we can say this is the motor center and the activity is raised. The same thing can be done for sensory functions or with visual functions and many others in our brain.
So, okay, so are there any neurocognitive tests that can accurately detect these changes for let's say, women?
We are still trying to set the right combination of neurocognitive tests that can give us a whole picture of the neurocognitive decline in the chemo brain and also in other kinds of inflammation, of accelerated brain aging, because we need tests that will cover both the cognitive part of brain functions and also this psychological part. So we need the combination of the tests that can say this person has decline in, for example, concentration, attention, but also the symptoms of anxiety, which is also something that will, let's say, exhort our brain, that will make it function with a lot of stress and that will enter the phase of inflammaging and accelerated brain aging.
Okay, so when we come back, we're going to talk a little bit more about brain aging, inflammation, and just basically brain changes as we get older. So please don't go away. Welcome back to Empowered. I'm Elizabeth Naumovski. On today's episode, we're discussing brain aging and inflammation. And I'd like to ask you that, Jasmina, is every person equally sensitive to brain changes in inflammaging?
No, the individual susceptibility to brain aging and to inflammaging is something that is like the hot topic in science. So what are the factors that will make you predisposed to accelerated brain aging? As far as we know, there are some genetic predispositions. However, like in every genetic predisposition, you have the gene, but whether the gene will get expressed, it depends on many factors, and most of these factors we can actually influence, both positively and negatively. So, for example, if a person has a lot of physical exercise, it will make it less susceptible to cognitive changes. So the more physical activity you have, the more cardiophysical activity that you have, the more changing physical activity that you have. So, for example, one day you do Pilates, the other day you walk, the third day you swim. So you change the rate, the pace of the physical activity. That will actually make you less predisposed to cognitive decline, for example. Then the kind of diet that you use. So you need a lot of vitamin B, you need a lot of fat, you need a lot of glucose. So actually our body, our brain is functioning mostly on the glucose metabolism. So we need the food that will make it function properly. Then the thing that I really lack, and I know that, and I'm trying to help myself with that, is sleep. So you need certain quantity of sleep regularly, so to go bed at the same time, to wake up at the same time, and to maintain the good quality of the sleep for the most of your lives, because our body, our mind actually, and our brain is getting cleaned from the stuff that we were doing throughout the day in the night. So it needs time to recover from everyday work.
Okay, so you talked about sleep, and I suffer from not sleeping. I'm constantly lying awake, thinking about what I have to do tomorrow and next week, and what's happening, and what happens if this goes wrong. And I'm planning 5 years from now. I'm constantly. What do you say to somebody like me that I need to function on sleep, but I'm not sleeping? How do I change that in my life?
That is a question for a life coach, maybe better than for a doctor, but I will try to answer you. So this is called anxiety, my dear Elizabeth. So this is something that you fight with physical activity, with going to bed always at the same time, maybe after warm milk, after warm bath, doing something. So trying to lower down your cognitive functioning hours before you go to sleep. Mm-hmm. So closing your TV, shutting down your TV, closing your books, shutting down your phone, your cell phone, and then trying to enter a peaceful phase before going to sleep. That is something that we always say to our patients, but actually none of us does it properly, I would say.
I know, we all struggle with it. But you also did mention vitamin B. Is there anything else that women can take that can help them with their brain function so that they don't, get dementia early on in life?
There are some studies that actually explore the hormone therapy. So women are protected by estrogen. So during our reproductive period, we are protected by estrogen from getting vascular changes. So after we enter the menopause, our level of estrogen goes down pretty fast. And then we don't have this vascular protection anymore. So we need to let's say, replace this estrogen with some other protective agents that will protect our blood vessels from getting old. So this is something that is important. I already said the diet, the sleep,
Yep.
being out in the fresh air. And they always say that you have to think happily, to have like positive thoughts in order to make your brain function better.
Okay, so when we come back, we're going to discuss this a little bit further. You have opened up a lot of questions in my mind, and
I'm sure.
and I know that there's no quick solution to this. I mean, everybody's body, everybody's brain, everybody's life is very, very different. But, you know, we do have a commonality where we are women and we all go through a lot of the same things. So when we come back, we will delve more about brain function. So please don't go away. Welcome back to Empowered. I'm Elizabeth Naumovski. On today's episode, we're discussing brain aging and inflammation with Jasmina Boban, assistant professor, Neuroradiology fellow, Vojvodina Institute of Oncology, Faculty of Medicine, University of Novi Sad, Serbia. Novi Sad, every time I say that, it actually resonates really well with me because that's where my parents met many, many years ago. So every time I see Novi Sad, it has a little special place in my heart.
I'm so happy. It's my hometown. I love it. It's on Danube. It's a 500,000 people town, and it's perfect place to live in Serbia.
Well, that's very nice. Hopefully the next time I'm out there, I will come and visit you.
I would be delighted. It would be great.
Okay, it would be great. So, Jasmina, I just want to ask, because this bothers me a lot. You know, we've talked about everything that happens as you get older, but the sad part about brain and aging, an aging brain and brain inflammation, is that more women suffer from this than men. Why?
We have several ideas why this happens. One is genetic, which actually is the same for men and women. So it means that we do something, that most of the women do something that triggers these genes more than in men. What scientists have come up to, apart from this estrogen thing that I already mentioned, was actually multitasking. They say that most women, let's say, I would not generalize, but most of us, we have families, we have children, we have our parents, we have our spouses, we have our careers. Most of women try to make a career as successful as men. And we have a lot of housework, a lot of, you already said, when I go to bed and I think, what am I going to do tomorrow, in 10 days, in 5 years? And we all do that.
Mm-hmm.
It's something that is, it's not specific for women, but actually most of women do the same thing. And also we have a lot of responsibilities, both to our children or grandchildren and to our parents. So in both, let's say, directions, which usually our spouses and men don't have at the same level as we do. We also tend to take over a lot of other people's work. We tend to do things individually. Leave it, I will do it. This is the sentence that most of women say every day. So this is something that actually tires our brain. It makes you do it for years at a very high level, and then your brain is exhausted. And when you enter the phase of mild cognitive impairment, most women go very fast to the manifest dementia stage. So this is something that when your brain starts losing its perfect function, it's called mild cognitive impairment. It is something that usually only this person feels. So you continue to cognitively work fine for your environment, but subjectively, in your brain, in your heart, you feel that it's not so perfect everything anymore. And then after several years, you enter the phase of manifest dementia. This part, this period of years, it's shorter in women than in men. And we now think it's due to exhaustion of the brain.
Interesting. So there's a minute left in the show. My parents love to play cards on a regular basis, and they're constantly counting and adding things up. Do you think that helps people with their brain function rather than somebody who's alone, can't hear, and is home by themselves?
For sure, they say that doing mental arithmetics of any kind, so playing cards, doing Sudoku, socializing, so entering like social clubs or going, traveling, meeting new people, that is something that will make your brain younger and function better.
That is awesome. Thank you so much. This has been very, very informative, and I know that you'll help a lot of women worldwide. Thank you, Jasmina.
Thank you very much. Thank you for inviting me. This was a pleasure for me.
On the Alzheimer's Society website, they mention a few risk factors that can increase your chance of dementia. They are high blood pressure, smoking, diabetes, obesity, lack of physical activity, poor diet, high alcohol consumption, low levels of cognitive engagement, depression, traumatic brain injury, hearing loss, social isolation, and air pollution. They also say that it's never too soon or too late to make changes that'll maintain or improve your brain health. I'm Elizabeth Naumovski, and I'm here to empower you and make frugality fashionable. Bye for now.